Good morning, all of you, respected dignitaries, my seniors. A lot of them will be my teachers during some point of time. My students, both in the SCB Medical College, I heard from Barampur and Bulla have come also. And obviously, they have seen a lot of me by now, because I spent 40 years in the medical colleges. So, my passion was to teach, and that is why I always love to whenever I got an opportunity, get an opportunity to talk to students, I always volunteer to do that. Anirvan insisted that I should come. Otherwise, mm, I was actually yesterday I was in the National Telemedicines conference because I'm also a very ardent fan of telemedicine, and I've been instrumental in organizing telemedicine in Odisha, which has helped a lot of patients. So I'm part of that. So I came back. I told him I'll not be able to come, but I had to come. Aninwan believes that I'm an excellent physician, but I don't know. I don't believe what I am. I've heard the introduction of some of the pioneers in different fields, so I feel very small that way. I don't think I've done something extraordinary. So he has given me a topic: excel as a physician. You can talk as an excel as a physician provided you know what is excellence in your work. So I'll just try to show you what I felt physicians, especially students, can do in an era of super specialized medicine. I can claim that I'm well positioned here because I've straddled both the sides. I was a professor of medicine for 30 years, and along with it, I set up immunology, rheumatology as a branch, and now I'm heading the department of immunology, rheumatology at SCB Medical College. So therefore, I know how super speciality is, and I also know what general speciality is, and I also know the difference. But at the core of my heart, I'm a thoroughbred internist because I believed the foundation of internal medicine is most important for a doctor, no matter what super specialization you do later on in life. So that is why, and he said is a personal odyssey. So I'm going to talk about what I learned and what I felt is important in my life. You can take a leaf out of that, or maybe you can think that this is redundant, I will do something else. That's fine. I have no disclosures because whatever I say is my personal opinion. So I'm going to quote myself. I'm not quoting anybody else in the sense that you should do this, do that. I will say what I feel you should do. This is a very important slide for me, for all of you. The choices we make determines our destiny. All of us believe that, I suppose. You believe that you want to be a doctor or an engineer or a civil servant or a lawyer. Fine. Then you decide where you want to study, what you want to study, which specialty you want to study, where you want to work, private, corporate, and where you want to settle down. And what should be your ideology, what should be your moral value, what should be your ethical value. They're all determined in course of time. But you must be very, very clear that the choices we make determine our destiny. And I'll show you the choices that I made actually determined my destiny. I come from a pure family of bureaucrats. My father, brother, brother-in-law, so everybody. So it was very strange. People thought how a fellow coming from a family like that has become a doctor. But it's my decision to become a doctor. And that is why I stuck to this, because I felt as a doctor one can do more service to people than as a bureaucrat. So that was the selection. And then I wanted to do medicine. Then I wanted to do rheumatology, immunology. So it was all well defined. The first thing is you have to be very, very decisive. And we never had a choice. Like we were appearing MCQ, I mean the examination, which was called JE then, and we had only one choice. Now you have a counseling. We never had a counseling. If you fail to qualify in medicine, you're out for 1 year. There was no second choice for us. So under that pressure, we have to get into medicine. So this is very important. I believe a good career has no boundaries. You can learn many things, multiple things. I did lots of medicine, and along with it, I was interested in infectious disease because that was the problem in India and in Odisha. The first picture you see is that of filariasis. I devoted a lot of time learning lymphatic filariasis because Odisha was endemic for filariasis. And my teacher, Professor Rath, who had projects on filariasis, so I was obviously involved in that. And next, I learned the second slide, which you see, was malaria, falciparum malaria, and I became a member of the task force, the national task force, NIMR, etc., because malaria gave me a lot of subject to work on. So these are two diseases which actually affected a lot of patients. I involved myself in these two besides other routine, other diseases that we see in internal medicine. But then I felt after a course of time, about 10, 20 years, that I need to change. Maybe it was not giving me satisfaction. The course in which we are going in general medicine has become restricted. So I needed something else. So I decided to become a rheumatologist and the joint disease, and rheumatology is a subject nobody knows, not many people know in this country. Till today, people say, "Sir, are you an orthopedic surgeon?" I said, no, I'm not orthopedic, I'm a rheumatologist. What does it mean? Which organ does it deal with? That concept is still not there in India. Therefore, we have very limited number of rheumatologists, about 1,500 in a country of 1.4 billion, and a disease which is 20 to 40%, which is about 600 million people suffer from rheumatologic disease, and they go to the wrong places. And therefore, this gave me a kick that I should do something which is different. So rheumatology is what I learned when I went to Sanjay Gandhi Postgraduate Medical Institute based on a scholarship. And then I saw understanding of rheumatology is incomplete if you don't know immunology, which is the basis of all understanding. So I did immunology, and I did my PhD in immunology. It is very rare for a doctor to go and do immunology, and I took 3 years off. I was not in the college. I went to the lab, sat with my guide, and I did basic immunology for 3 years. That's how I got a PhD, and my understanding became much more clearer both in medicine as well as in rheumatology because of this interesting aspect of the subject. Mind you, these two subjects are never taught to us in MBBS or in MD. Nobody teaches you, and these are two subjects not many people focus on. Microbiology, of course, they have to do basic immunology, but application of immunology was not known. When I was trying to get a PhD, I applied, and the gentleman at the secretariat told me which branch it belongs to, which organ it belongs to. I mean, organ. You have to be a cardiologist, neurologist, nephrologist. I said, immunology deals with all branches. Every system in the body deals with immunology. So that is how I couldn't convince, but I still stuck. And I managed to get, because the then Chief Minister of Odisha, Mr. Bidyut, although this gentleman in the secretariat wrote nasty things about immunology and me for 3 pages, which I came to know later, Mr. Patnaik, the visionary, at that point of time in 1992, he read my resume. He said, here is a man, a clinician, who is interested to do research in a subject which is not, we don't know what result will have. He should be encouraged and given full benefit and doubts. That's the visionary. I have never seen that gentleman. I have never been close to him. But you see, one man's vision can change. And actually, I changed the pattern of approach and the establishment of this branch in Odisha, which has helped millions of people. Will help millions after I go. It's a legacy. So this is where I learned immunology. And then I was wondering at a point of time, why did I learn so many things? I came across this man, Steve Jobs. Everybody knows Steve Jobs by now. He said, you can't connect the dots looking forward. What you did, you don't know. Why you did, you don't know. You can only connect them looking backwards. So you have to trust that the dots will somehow connect in your future. You do a lot of things. You don't know why you've done it. He dropped out from college after first year. Whatever he has learned, he utilized that later on when he was doing Apple. And I look back and I see what I did as a infectious disease specialist, then as a rheumatologist, immunologist was so important for me because infection is one of the biggest trigger for autoimmune disease, biggest trigger. You have a genetic predisposition and you have a immunological, you have an infective trigger. and that together gives rise to immune dysregulation, etc. etc. It's very complex, but infection plays, and I could actually connect. And I work on a subject called the role of parasites in autoimmunity. Nowhere in the world people do. My papers have been circulated all across the world because it's new, novel. Nobody knows what parasites does to the autoimmune disease, and I showed them that parasites, especially filariasis, protects you against autoimmune diseases, protects you. But the government now wants to eliminate parasites, especially filaria. It's almost on the verge of being eliminated. And because of mass drug administration, which is being given every yearly. Understanding, that's what we lack. The choice of studying in a medical college, I always look up at Harvard Medical School because the best in the world. Whatever you do, please think about the best in the world. This is the best because it is number one in the world. And this university has produced 161 Nobel laureates, highest in the world. Why? It has some environment. They understand what they teach. And the students are absolutely high quality. I don't say that all of us, any of us will land up in Harvard, but at least understand what they do right. Maybe we can do. At that point of time, to study in SCB Medical College was a priority. If you get it, you've got gold mine, because that was the best in Odisha at that point of time, and one of the best in the country, because it had wonderful teachers. A university or a college is not the number of big buildings that you have, beautiful, swanky buildings. It is the intellectual property, students, teachers, the quality faculty teachers who determines your career, not the buildings. If you have brilliant teachers as your guide and mentors, you have made it. You are very lucky. And I was very lucky because I got into the company of some people who told me this is the way, immunology is the future, research is the future. That is how I went. So you need a good mentor. What is the convocation, Harvard convocation said about education and what we understand? Not just transfer of knowledge from one source to other. Somebody gives you a lecture from the books, you just rot it and then go back and produce it in the examination, get some mark and get lost. That's not the purpose of education. It's a transformative process that changes life from ordinary to extraordinary. That's what they believe in. They don't believe in just picking up knowledge and going back home. Let's come to the next greatest mind in the world of the millennium, Albert Einstein. What did he have to say about the education that we learn? Not just learning of facts. I'll ask you, tell 5 causes of anemia, 10 causes of upper GI bleed, 7 causes of bleeding per rectum. I mean, these 5 causes of fever. I mean, these are facts. He says not just learning facts, it's training the mind to think. Why anemia occurred? Why fever occurred? What are the possible consequences? That's called thinking, which is absent today. And we were being taught at that point of time, our teachers told us, you have to be critical. Whatever you do, think critically. The most important thing is not just rot, memorize stuff, but think critically. And that's what made our minds very, very sharp at that point of time. Further, what did he say? The only thing that interferes with my learning is my faulty education. I mean, coming from Einstein, I can't believe he was not a very good student in school. Neither was he a great student in college. But he became the greatest mind in the world. Why? He was full of curiosity, and he was full of asking, inquisitive mind, and then he was thinking, critically thinking about problems, sitting down and thinking. In medical education, it's so vital when you get a case to think at the bedside what this patient is having based on his symptoms and signs. And this has become less these days for multiple reasons, which I'm not going to go into. So, selecting your alma mater, which if you're lucky, you got a good college. You're very lucky if you've got brilliant guides and mentors to teach you, train you. Then finally, this study, Jim Rohn, this also came out from Stanford, another big university. IQ is the average of 5 people we spend most time with. You're as good as your 5 friends. You move around with people who do rave parties, or do your, what is called a party animal 5 days in a week. You're that. And so you have to be very, very selective about your friends. And I was very selective at the point of being called arrogant. Oh, he doesn't mix with us, so he's an arrogant guy. If you don't speak with many people, you're arrogant. Not that. You have to have people of your vibe. If you want to grow up, you have to pick up people who are better than you. You have to be friends better than you. And that's what this study showed, that your IQ is what your 5 people with whom you mix with. Very, very important. Select your friends judiciously. Medicine is too big, too vast. None of us can actually memorize it, learn it, because everything changing every year. So we are like blind men, and we are looking at the elephant like a blind man. What medicine is, what the different subjects are, what specialities are, and that has given us limited knowledge. But we think we are great. We know lots of things, and leads us to believe it to be the whole truth. Unfortunately, is not the whole truth. Everything changes with time. So medicine, you have to have a very wide mind, not a restricted mind. Just to get some marks in the examination should not be your motto. The motto should be to learn as much as you can. So to summarize the kind of college, kind of teaching, kind of students, friends you have to build what is called excellence. Excellence is a habit. Everything you do, it has to be excellent. It's not a one-time act. And learning is a continuous process. In medicine, all of us, we have to learn. Every day we have to learn. 5,000 articles are coming out in the world. We can't do. We are focused on whatever we learn, we are interested in. We have to focus on that. But it has to be continuous. Only during exam I get up and mug up and then go and produce something and come back. That's not the way you learn. It has to be continuous. It includes gathering knowledge, not information, knowledge, skills, and you must know how to apply it. And this is over the years. And Einstein again repeats, once you stop learning, you start dying. You have to learn. You have to read. You have to see papers. You have to attend seminars. So keep learning. That's very, very important. What is the quest today? Degrees at any cost. I want an MBBS, I want an MD, I want a DM, I want this, I want that. Degrees, any cost, at any cost, you get it. To me, this is again my personal opinion, is it simply a piece of paper, a degree that we get. If it has not provided you critical knowledge, how to analyze a patient, how to analyze a problem, it has not given you the power to rationalize a problem, it has not taught you the capacity for application. That degree is useless. People come and say, if you see some of the people writing, Dr. So-and-so, MBBS, MD, MSD, FICPs, MSCP, you see huge lot of things. In India, we are very fond of these figures, very, very fond. In America, you don't see that. They just write MD, PhD, or MD something. Here, half a page of your so-called qualifications, which are absolutely useless. Most of the time, they are all fellowships, which has no meaning. Robert Feynman, another Nobel laureate, brilliant guy. His wife left him because he was playing bongo in the middle of the night. He gets up in the middle of the night and starts playing the bongo. So his wife got so annoyed, he said, I'm leaving you. He got no prize. He said, you can have a degree. He used to tell his students, but still be an idiot. Harsh words. So if you're too much dependent on getting these piece of papers by moving around, paying money, getting things done, remember Robert Feynman, that you can have a degree but still be an idiot. Now, most of us, when we get into a medical college, when I got in 1974, so excited, I couldn't sleep that whole night. Oh my God, I've become a doctor. Before the doctor, everybody likes to write a number, doctor so-and-so, otherwise not. Even first year, second year, you carry a stethoscope even if you have not seen a patient. That's some kind of a pride you gather. And you see stars in our eyes, all of us. And we have passion in our hearts. I'm going to be a doctor. I'm going to help people. Every time first year I ask, what do you want? Why did you choose this field? Oh, I want to help people in society. Great, great ideas. Does it last 2 years? No. The stars become black holes. And the passion just melts and becomes anger, volcanoes. Oh, this is useless, this is bad, so much of time is lost. Our friends are engineers, 3 years, 4 years earning so much of money and we have no money. So that feeling, that comparison comes in and then you feel very bad. I never lost the capacity to stars in eye. I still see stars today. I never lost my bearing of why I became a doctor. I never compared myself with anybody around me. My brothers, everybody, they were IS, big secretaries, but I didn't care. It doesn't matter. But they finally came. They'll come to you for medical problems. When they retire again, they'll come to you 10 times. But doctor remains a doctor throughout his life. So you have to persist. Don't get frustrated. It's a brilliant profession. It has lots of power, provided you know how to use it. And people will respect you for that if you can maintain the ideology and the reason for why you joined a medical college. Think about it. When you were asked in first year what you said, and in third year, fourth year what you do. So we are supposed to learn what? Theory, didactic lectures, and we never missed a class because we had no other way to learn at that point of time, either library or the classroom. And the teachers were very good. So we were focused. Attention is most important for learning. If you're sitting and you're thinking about movies and some film stars or cricket, then it's gone. And nowadays, people are not attending even theory classes. Obviously, you say everything is there in the net. We get everything in the net. And then everything is taught in the tutorials. I heard some marrow, sparrow, something, I don't know. It was alien to us. In MBBS, they are doing tutorials. In MD, they are doing tutorials. So, it's very strange. Of course, theory can get boring if it is not interesting. But one can make it interesting, provided you know how to extract the things that you cannot get from nets or from tutorials. And the most important part is your bedside medicine, clinical medicine, which is almost dead now. We never lost a time. I never, right from third year, I was in the clinic in the evening telling my PG student, telling my seniors, senior PGs, my staff, sir, please show me this sign, that sign, this figure. So every day I have to learn something, every day. You become a doctor only when you go to the clinics. You don't go, you're just a theoretical idiot. And bedside teaches you real practical medicine, which you don't do. And we spend even today I still see a patient from head to toe, even today. I never bypass a patient. Research is alien to most medical colleges, most medical students. Now people are talking about research. In my PG, my professor gave me a senior research fellow. He said, you do research on filariasis. So I was very happy because PGs were getting 400 rupees and I was getting 800, double. So 800 rupees for us at that point of time, and people used to borrow money from me because I was getting 800 rupees. That stuck. That senior research fellowship continued, and I was so interested in research that I have continued for 40 years. And this is what gives you recognition, nationally, internationally, your research work and your papers. Undergraduates, people who came to me, 5 of them, 3 of them are in US, I mentored them. 1 is in Germany, 2 of them are here. And they've all done Superspecialised and they have published papers. And they understand the importance of research. I always said undergraduates must learn research. Over the past 20 years, the average attention span has dropped from around 2.5 minutes to approximately 45 seconds. This is the study that was done in the US. Our attention span is so low. The culprit, gadgets, laptops, smartphones, and of course, social media. Instagram, Facebook, Twitter, etc., etc. Thank God we had none. We were never distracted because our only focus was study. And it's important even today. Good, you have gadgets, but don't become a slave to social media, a slave to a gadget. Do what is necessary to become a good doctor. So it has affected the Americans also. This is called flipped classroom. This has come from Harvard again. They said, okay, people are not attending, they think everything they know from the net. So the flipped is an instructional strategy, a type of blending learning which aims to increase student engagement. You are not just listening, you are engaged with me, interactive. Of having people's complete readings at home and work on live problem solving during class. I give you a problem, you come back next day after having reading, and I ask you, you answer. So it's an interactive session. It's not that I keep on talking and you keep on listening. That doesn't happen. So this is called flipped classroom model. This has been going on in Harvard for quite some time. So one can improve on that. One can ask his teacher, sir, can we have a flipped classroom? Maybe have a course like this. Whatever you teach, tell us today, so we'll prepare, and next day we'll come and debate about it. And surely, this is the most important part. Learn medicine from bedside clinics. Never miss a clinic. This is very, very important. And surprisingly, very few people are attending. They don't understand the importance of this. Most of the time, they are in some other place. Tutorials have taken over. I believe I made it in red because I think these 4 statements are very, very important. There is no substitute for bedside medicine. No substitute at all. I agree. I fully again repeat, there is no substitute for bedside medicine. You might have mugged up the whole Harrison textbook, but still you'll remain an idiot because you've never seen a patient. Medicine is not learned in the classrooms. You get some knowledge. It is learned in the wards and from the patients. I think all my seniors, teachers who are here, they must have gone through a similar experience that I went through during my early days. What their teachers told me, how they learned. Of course, they also never had the opportunity to have social media and gadgets at that point of time. Clinical bedside medicine is the foundation for subsequent learning and one's ability to diagnose and manage cases and excel as a doctor. There is no second thought. And what did it teach us? Taught me, and it will teach you. Power of observation, concentration, critical thinking, capacity to rationalize a problem, beautiful communication skill. When you talk to patients and the attendants, you take their history, that communication skill you have to develop, otherwise it's very difficult. Good history taking is so important to get a diagnosis. Empathy, you feel for the patient, how difficulties they are facing, what are the problems they have, and compassion, you try to help them. I think the medical service is based on empathy and compassion. These are the two. What I gathered from now, it is entirely based on that. And you can only develop it when you go to a clinic, see a patient, see its condition, see its status. You'll develop that. Otherwise, so what has been my principle in my career throughout, and I believe that this is going to help you a lot. Stick to it. Spend time with patients to obtain a good history and do good physical examination. Mandatory. Use your common sense and critical thinking to arrive at a diagnosis. Do not order a sophisticated and expensive test when simpler tests can provide needed information. Do not administer blindly a ton of medicines, 10, 20, 30 IC prescriptions. Not rational. Recognize that doing nothing is at times doing a lot. There will be patients who come to you with pain all over the body. You examine, there is nothing. Just tell them, counsel them, do nothing. But they are taking 10, 15 analgesics, antihypertensive, and painkillers. Be aware of your fallibility. And don't be afraid to say, I don't know. What you don't know, I tell my students, sorry, I don't know. I will check in the books and come back. You're not supposed to know everything. What you don't know, you don't know. Ask your teacher. Even a teacher doesn't know many things. But he has to accept without ego that despite being a professor or teacher or whatever, I can still be fallible. I can still be vulnerable. I don't know. Students don't feel ashamed to say I don't know. That's the beginning of learning. When you say I don't know, that's the beginning of learning. And most importantly, stick to ethical norms. Ethics is something that is non-negotiable. Morality is something that is not negotiable in our profession. In our profession. Maybe in all professions, but in our profession it's very important. He's my master. I follow him. It's called Osler, William Osler. If you have not heard him, please read his books. Brilliant. 1930s, he was the master of, there was nothing, he was the master of clinical medicine. And whatever he said is almost like gold dust. He who studies medicine without books sails on uncharted sea. You never read a book, but you go and say, I'm a doctor, I'm Dr. So-and-so, but you have never read anything. And those who study medicine without seeing patient, they do not go to the sea at all. And most of us are like that now. You never go to a clinic. Obviously, you read some books, go to the tutorials, gain some knowledge, and you say you are a doctor. You are like somebody who does not go to the sea at all. The second brilliant thing he said, observe, record, tabulate. Provided you go to the clinic, you will observe, record, tabulate. You don't go to the clinic, what will you observe? Simple 5 senses are important. You need learn to see, learn to hear, learn to feel, learn to smell, and know that by practice alone, you can become an expert. Brilliant. Absolutely brilliant. And then finally he says, what's the difference between a good physician and a great physician? A good physician treats the disease. A great physician treats the patient who has a disease. You have to take a person as a human being. He has multiple things. Oh, he's a case of cirrhosis of liver. He's a case of myocardial infarct. He's a case of stroke. I mean, you are commodifying somebody, but you're not supposed. You have to treat him like a human being who has a problem. That's the difference between a good teacher, a good physician, and a great physician. You have to take him as a whole. With the advent of superspeciality, what we are seeing today, last 20 years, clinical medicine has to a great extent shifted from bedside medicine to investigative medicine. True? We have forgotten the subtle art of medicine propounded by Osler and are depending too much on investigation. All of us will believe. We have seen what we are doing that. But we do need to understand the significance of progress. Yes, we need to know what progress has occurred. Good clinical medicine and modern investigation should be taken together. You have to understand your foundations, your basics, and then go to the investigations. The world has seen so many technological advances, and we need them. I'm not telling we don't need them. After you have been soundly taught on the principles of basic medicine, we need an ultrasound for abdominal problems. We need a CT MRI for strokes. We need a PET scan for malignancy. Artificial intelligence robot is the flavor of the day. I'm not going to talk about it. But there are lots of biochemical, immunological markers, advanced histopathology. But we don't go and jump. We don't see a patient and order an ultrasound, CT, MRI, PET scan. I rarely see a patient in the OPD without a bunch of investigations. Diagnosis is pain abdomen, diagnosis headache, diagnosis fever. You don't write like that and ask MRI, CT, and this. I've never seen a low backache without an MRI. Every patient who comes to me with a low backache has an MRI, no longer a simple X-ray. Every person who comes with a headache has a CT scan. Every person who has a pain abdomen has an ultrasound. And surprisingly, none of them have been seen. None of them have been examined bedside. That is the state. So, obviously, we have to take them, we need them, but appropriate. Where it is appropriate, use them. So, the poor patient, what does he do? Is now burdened with a deluge of investigations. And you say, oh, this is not enough, you need more. And we call that evidence-based medicine. You collect more and more data without examining a patient, you call it evidence-based medicine. And then you get evidence. And you get lots of evidence, and you do not know how to interpret it, how to use it. And then you say, okay, we'll do patient-centered precision medicine. These are beautiful terms that we use today. Patient-centric. Don't touch a patient, look at the computer, look at the laptop, and look at all the investigations. That is patient-centric. And precision medicine. Oh, your prostate PSA is just 6.7, you have got prostate malignancy. Okay, your HbA1c is just a little bit, so you have diabetes. This is the type of prescriptions we see today. Why? Because we don't know how to interpret. There's a great guy called B.N. Hegde. I think you've heard about him. Dr. Hegde was Vice Chancellor of the Manipal University. He gives talks, he says, who is a patient? A normal man, when he enters a doctor's clinic, comes out, he becomes a patient. That's the definition. Why? You'll ask him, you'll tell him to do uh, this panel, that panel, 20, 30 tests. And obviously you'll get some, and the laboratory has its own parameters, make it in red. He'll give it in bold, telling that this is wrong. And patient will come, sir, this is in red. So what do I do? I'm a patient. I'm suffering from this. I think all of us have seen such a prescription. Arthritis panel. There is nothing called arthritis panel. If somebody has rheumatoid arthritis, you do a rheumatoid factor. Lipid profile. One of the most misused investigations people use. So this investigation that we are used to has created a host of problems both for the patient as well as the doctors. And of course, now you know, if you start learning from Google University and the patient is called to be an idiot, what is idiot syndrome? Idiot syndrome is information dependent something based on this, based on your computer knowledge. I call it Google syndrome. All of them will come with, where do you, sir, I read it in this net. This is how. So Dr. Hegde was very right. A patient is one normal person who goes to a doctor, he becomes a patient very next day. And then and once you feed him that this is abnormal, that is abnormal, then lifelong he will remain that. You label him as a patient, he cannot come out of it. I'm giving you a case recently. I saw this case. He came from Pune. I was surprised. An army man. He had swelling of fingers, of both fingers, difficulty in making a fist, tightening of the skin around the fingers, 6 months. He was a diabetic for 20 years. Coronary artery disease, 2009, under medication, diabetes control, blood pressure was controlled. But MSK, no tender swelling. There was no tender swelling. Most important points of joints. If you don't have tender swelling, you don't call it arthritis. Other systems were normal. He was subject, he's gone to Pune, Delhi, Calcutta, finally landed in Bhubaneswar. He knew somebody in Bhubaneswar, came to me. He was subject to investigation from outside for rheumatoid arthritis, connective tissue disorders, scleroderma, multiple myeloma, chronic regional pain syndrome, you name it, everything was there. He had a huge file like that. And I saw what investigation has been done. CBC, urine, ESR, CRP, rheumatoid factor, anti-CCP, HLA, ANA profile, serum membrane, kappa, lambda, microglobulin, chest X-ray, MRI hands, MRI spine, MRI pelvis, CCT thorax. Please have a look. And then again, he said, no, vitamin B12, something which people are doing, vitamin D, vitamin B12, serum PSA, serum cortisol, CT scan, whole abdomen, DEXA scan, upper GI endoscopy, colonoscopy, echo. And then somebody told, we need a biopsy of your flexor tendon. He ran away. He got scared. Once you say you have a biopsy, he ran away. He landed with me. And he says, and an MDP scan. You need a bone scan. Something sinister. He walked. He presented to our rheumatology OPD December 22nd. Examined, demonstrated the classical prayer sign seen in diabetics. It's called chiroarthropathy. Counseled him and left him. You have no problem. Go back. Control your diabetes. He blessed me from the core of his heart. Sir, I have not slept for so many months because I've seen so many people, so many investigations. And we say what the mind does not know, the eyes cannot see. Hundreds of investigations, spend lakhs of rupees. Simple prayer sign, you just do. You know he's a diabetic. They are fundamental. Everything is normal. Why are you still wanting a biopsy? So I'll make a little conclusion from what I've learned. There's no substitute for hard work and for good physical examination. Develop passion for what you love. You have joined medicine, love it. Don't throw it. Don't say, oh, somebody is doing better and you will also do better. Just stick to it. Love it. Love with your full heart. Develop persistence. Don't quit. Dream big. One day I will make it. But don't think about overnight stars. You can't become an IPL star overnight just because you scored 100 someplace or maybe you got a picture to act in. Don't think about those things. In medical science, it has to be pure hard work. So what did I do right through my, now I'm going to do a little bit of um, throwing my weight around, because Anirban told me whether I'm trying to see whether I've really excelled in all these 40 years. I followed these three principles, three P's, straight away. I'm telling you, I've never followed. These are three P: passion, persistence, and patience. I never gave up on anything. Whatever I did it with these three. And this was the cricketer that I was into, if you have the courage to pursue it. My students, you've seen my struggle. I never gave up. I worked with a smile on my face. I worked till 11 p.m. I saw patients. I avoided private practice because I could not do both. It's not possible. Make money and do academics at that level. I was not, maybe I didn't have it. But maintain that morality and that ethics and do work that is useful, that will be remembered for generations to come. So I can just give you a little bit of take-home message. Keep learning. As I told you, once you stop learning, you start dying, as Albert Einstein said. Develop mastery over clinical medicine, what William Osler told. Be curious, what Albert Einstein said. Learn new skills. Understand the appropriateness of investigations. Don't just do random things. Broaden your horizon of learning. I did medicine, I did infectious disease, I did rheumatology, I did immunology, I did a lot of things. Telemedicine. So broaden your horizon. Don't remain fixed. Remain humble. You develop an ego very soon. Once you get a couple of prizes, something, a little bit of mark. Be humble. Moment you develop arrogance is the end. But most of all, be a good human being. A good human being can be a good doctor, good engineer, good. Without that, it's very difficult to shine, really. The grace of God comes on those who remain humble and who believe that they are not the person who do it. I believe now, whatever I did, it was the divine blessings that came through me. I didn't do anything. God wanted me to do it. That is why I'm what I am. Thank you very much.